Hi. Okay, welcome. Welcome
Thanks, Becca.
everyone, and welcome Dr. Schade for being here with me on Talk Time. We're just starting. This happened to me last month too. We started a little bit late because I had some technical problems right at the last minute, even though we were all queued up for a really long time beforehand. So welcome everybody, and let me introduce you to Dr. Lori Schade. Dr. Schade is, well, why she's on today, she's like a great therapist, and she's an emotionally focused therapy supervisor, but she also won this fall the AMFT Research Award for dissertation, for her dissertation, which is what we're going to be talking about today, warmth. But say hello, Lori, to the group today, if you would.
Hello, thank you for having me, Becca. This is really fun. I'm excited to be here.
It's really great to have you. So tell us just a little bit, why don't you, just as we start, a little bit about yourself and a little bit about what inspired you to do this research on warmth in couple therapy.
Okay, sure. Well, a little bit about myself is that I actually went to graduate school over 20 years ago to pursue a master's degree in marriage and family therapy. And back then, emotionally focused therapy really had not been manualized as a treatment. And so I graduated in 1992 with my master's degree, and I would work on and off. I worked a little bit, but then I also was raising a large family. And then I went back to work about 6.5 years ago or so. And when I did, I just really fell in love with emotionally focused therapy because it had a lot of those process experiential things that I used to use in couples therapy that I thought worked. And so as I became interested in it, I went through the certification process and then went back to get my PhD at Brigham Young University, which is a very research-focused clinical program. And so while I was there, I worked with Jonathan Sandberg, who many of your listeners may recognize as one of the EFT researchers as well, and had been one of my certified supervisors. And so that's sort of how I got working on the project, and I graduated last year and have been working ever since.
Yeah, so you were, really had been an experienced therapist, but came back for your PhD and needed some research in the field, and you were really studying couple therapy and the particular model of emotionally focused couple therapy. But so there was an opportunity or something happened that, you decided to look specifically at warmth.
Right, right. So what happened was, as I was working with Jonathan Sandberg as a research assistant, and we actually had funding to provide therapy for several couples, and we were collecting data to be used for initially. He was working with Julia Holt-Lundstad on some physiological factors in couples therapy, and some studies came out of that. And I was working with him on some EFT fidelity with Wayne Denton. And
all really great. If
right.
Anybody that's involved in emotionally focused therapy, which many of our listeners may not be, it's really great research that Jonathan Sandberg and that you were doing with him as part of that team that was so specific to emotionally focused therapy.
Right, right. And so I really wanted my dissertation to be something that would be meaningful for clinicians, because an ongoing problem in the profession, the way I see it at least, is that often there's a disconnect between research and clinical work. And so I really wanted my research to be something that would make sense for clinicians and that would inform the way clinicians do therapy. And so process research actually happens to be some of that really valuable research for clinicians. And Brigham Young University happens to have a coding lab available where they use a lot of coding for their flourishing families research. And so Jonathan Sandberg consulted with Jim Harper, who oversees that lab, and said, hey, could we get this data coded by these externally trained coders who are not therapists, and independently see what some of the therapist variables are that will influence husband and wife work toward each other. And so as
Right.
we looked at some of those behaviors that are coded, we theoretically picked the ones that we thought were in line with EFT theory and practice, and we came up with actually initially warmth, listener responsiveness, communication, and dominance, which is actually a structuring variable.
Right.
And and so my original dissertation included these four variables as how they related to warmth. And we chose warmth because that was the coded behavior that made sense to us for what would happen in a softening or bonding moment in therapy.
Hmm.
Anyway, long
So
story short.
yeah, let's go. Let me just see if we can recap that, because I think clinicians that aren't involved in a university setting, there's a key thing that you're saying in relation to this research path, is that you had the opportunity to be involved with a coding lab that are difficult to find and very
Very
expensive to
expensive.
operate.
Correct. Hmm.
And process research is really the research that can so inform us as therapists about what's actually creating and affecting change in our day-to-day work. And so this was really such a great opportunity to be able to have access to that lab.
Right, right. And to have the external coders because it reduces research bias, essentially.
That's right.
So
So
that's why.
if you have people that aren't therapists, aren't involved in a particular form of therapy, that are external and
Right,
independent, you say independent, that they're not going to be skewed by what's happening in a particular type of therapy, because they are independent, and so that really adds some strength to the research.
right. Definitely reduces bias. And um, there was something else you said, but I lost it.
Reduces bias, and the independence of it adds, like, that is the bias, I guess, just the strength that adds to have that independence, and they're not particularly trained in their own modality. They're really trained to code um, from the scales, from the coding measurements that you're using.
Right, right. And I just remembered it from what you said is that you pointed out that what is so valuable is trying to delineate what the mechanisms of change are in therapy. So
Yeah.
we've known for a long time that alliance is something that really matters across models. And so warmth could be considered probably a subvariable of alliance, but
Mhm.
that also was partly why we chose warmth.
Right, and so we're that direct connection is kind of a new thing to be thinking about. How that variable, how warmth increases alliance, or how alliance impacts warmth. That those would be some other variables to kind of look at. But so you developed a construct through the coding. Maybe you can walk us a little bit through the coding system that you used, and that will lead us, maybe, into some of your results.
Sure. So we used the Iowa Family Interaction Rating Scale.
And
And it's
why?
like,
Tell me, what's so great about that rating scale?
well, it's been around for several decades. It's a very established and recognized rating scale, and there's a lot of training involved for reliability purposes because obviously when you have external coders, you have to make sure that your coders are going to have a high rate of reliability so that they would be coding things the same way another
Yeah.
trained coder would.
That
So
inter-rater reliability is such an important factor in having good research. So you have
yes.
multiple raters, and that they would look at things and they'd see them very similar, they'd code them, the reliability would be really high.
Absolutely, and there's a very extensive training process, and they have to achieve a very high percentage of reliability, and then they're consistently checked. So we actually had a few things coded that got sent back to be recoded because the reliability wasn't high enough. And so it's a very rigorous process that's involved in training. And like I said, it's traditionally been around for a long time, and there are a lot of validity studies that are done on that. So there's a whole body of literature related to this particular assessment.
So it's a really well-used assessment, really well, the
Yeah.
coders are really well trained. It has a lot of validity in the field for being used, and so
The
those
process
are all
has to be
factors that make your research something we can really kind of hang our hats on, right?
right, right.
Yeah.
So,
Okay, so tell us a little bit about what you found.
okay.
And then we can
So,
break it apart a little bit about what the
sure.
components of that are.
Oh, sure. So just as a review, we looked at warmth, and warmth is actually made up of three sub-constructs, which is based on nonverbal warmth characteristics such as smiling or affectionate gestures, a supportiveness construct, which has to do with praise, encouragement, and showing concern for the other person in the dyad. And again, these were coded in dyadic relationships. And then content area for expressions of affirmation, praise, or liking for the other individual. So that's how warmth was measured.
So
And like
that's really important because warmth is like uh, one of the things that you were excited and got me excited about it, that I've been so excited about in relation to warmth, is it's very simple, but it also has some very distinguishable factors, and you couldn't measure it and research it if those kinds of variables weren't really picked out. So to be able to say these are the components of warmth that we find really matter, like the nonverbal gestures, facial expression, touch, perhaps, these nonverbals that come to play. We could think of some things to do with pacing and speed around body language. All of those,
right.
eye contact, right? All of those nonverbals are just one area. And then these other two areas of support and actually what we say. So what we say is just a small piece of conveying warmth. And then the other two pieces of nonverbals and support. So could you go over support again? I just picked apart nonverbal.
Yes. So support was expressions of concern, encouragement, or praise, which was.
So we would kind of think about that, about providing validation, being verbally supportive, praising, validating, and direct encouragement. So it's very explicit kind of encouragement.
Yes.
Okay, and then what about content?
The content area included expressions of affirmation, empathy, liking for the other individual, things like that.
Okay, so, and how that's different from support is that one is more directed to the other, and maybe one is more about what's coming up for me.
Well, I think they're also very intertwined because it's a global rating. You know, as the raters are watching this, they're using these three interrelated constructs to give a warmth score. So I think it's something that and then they have to have that high reliability. And it is independent of, I feel like I need to say again, it is independent of listener responsiveness and communication, which is a clarity measure, because sometimes we think if we just demonstrate listener responsiveness, we're being warm, but
that is so important.
Different.
That's such an important thing, that it's not about us being good listeners, being reflective listeners, being attentive listeners. It's not about that. It's about what we're actually emitting, right? Not what we're doing in the way of receiving, but what we're doing in the way of offering. And those are very, very different things. And I used to think they were the same thing, right? I used to think I was a great listener, that my clients knew that I liked them, that I liked working with them, that I had hope for them. I used to just think that it was a good reflection was the same as a validation. And they're really very different things. One is like what I'm conveying as far as what they're giving me, and then the other one is actually direct conveyance out towards them.
Correct. And I think
warmth has to do with that. It doesn't have to do with listener responsiveness. When we're talking about warmth, you're talking about what we as therapists are giving out.
Right. I think of it almost like that right brain to right brain process Alan Score talks about, Dr. Score. I mean, I don't know if that's appropriate or not, but as I was reading his work, I thought, oh, this is sort of what is going on here with
Yeah,
more.
so being in some sort of resonance or something.
Hmm.
Although, there at times, I mean, I was with a very distressed couple last week. Well, a couple of them, but one, and I'm thinking of one right now. And there was an initial resonance, but my warmth helped create that the responsiveness from them to
Yes.
me, which helped bring down the escalation in the session. So
Right.
you can get to resonance, but you can also use warmth. You can use warmth in other ways besides just being resonating.
Right. Right. I agree.
Okay, so you've got these kind of three ways that are intertwined that were the scorers were watching couple therapy sessions, recordings of sessions, I guess.
Yes. So they fast forwarded 20 minutes in, so they would make sure that they were in the middle of therapy process, and then they coded for 10 minutes of the session. And it was longitudinal.
Hmm.
So we got not the first session because that session was not, that's an introductory session. So it was, I believe, the second and the fourth and 11th, but we wanted sessions representing beginning, middle, and end stages of therapy and wanted to see what was going to happen across time. And we used a mixed effects model statistically for that.
So you were seeing longitudinally across sessions the change that happens related to what the therapist is doing with warmth,
Yes,
how they're
yes,
interacting with their clients with warmth.
yes. Hmm.
Okay, and you found some pretty crazy and great stuff.
Yeah, yeah. Do you want me to talk about the numbers
Yeah, that'd
that
be
we
great.
found? Okay. So essentially, what we found was the significance was from therapist warmth to husband and how it related with husband warmth to wife. And that was really the only significant pathway we found. But we were excited about it because of some of the things we know about men in couples therapy, and particularly if they fit in the category of withdrawing men. And
Hmm.
from watching these sessions, like I said, we didn't code these particularly for whether it was a pursue withdraw cycle, but they looked very typical to me when I was watching the sessions.
So that's a really interesting thing because while you're an EFT supervisor and you're working with maybe student trainees who are doing EFT or trying, I guess, right?
Right.
They've had the externship or the basic training, but you and I know that it takes a lot more practice to be
A
competent as an EFT therapist. So,
lot.
so it wasn't necessarily EFT, and that wasn't the focus of the research. It was really on what the therapist is doing, and that's one of the things I guess we're so excited about warmth is because if you can take a student who doesn't really have a model well developed or established, or doesn't even really know a lot about couple therapy and doesn't have that experience, and interject warmth, you found some really amazing things that happened across time.
Sure, sure. And Dr. Jim Harper, who runs the coding lab or is involved with that, and who was on my committee, actually said after he looked at the findings and he sat in on my dissertation review, he said this would change the way he talked to students about warmth and about how they were in therapy because he was so impressed with these findings. And I know that it's changed the way I talk to students about warmth because I teach practicum in the graduate program at BYU, overseeing the students' therapy. And it's really important because warmth is so simple and something they can actually do, and yet students don't tend to be very warm because their anxiety is so high when they're learning how to be therapists. So,
And if we're also, that happens with experienced therapists, if we're working with
yes,
difficult couples, our
yes,
anxiety goes up, or we're trying to maybe resonate with them or understand where they're coming from, and we're like working really hard to understand that our warmth will just go down, right?
right, right. Absolutely, and I've got a couple examples later if you want to hear that. But basically what we found was that the therapist's warmth to husband accounted for almost 30% of his warmth to his wife, which is really pretty impressive in
That's
statistical
so
terms.
huge.
Yeah, it's
And
really good.
statistically speaking, that
Right,
how I am as a therapist warm, so non-verbally, expressively, supportively with the husband. This was all heterosexual husband-wife
right.
marriage therapy.
Mhm.
That directly impacted how the husband began to treat the wife, the
Right,
warmth.
right. And so for every unit of therapist warmth, it increased the husband's warmth to his wife by 1.19, almost 1.2. So by almost,
Almost 2 whole points.
no, 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 1.119. But that's about
Oh, 1.11,
20%,
almost 1.2.
about 20%
So
increase.
it not only matched what the therapist did, but it increased on top of what the therapist did. So how, if I was a therapist, how I would communicate, express warmth, be warm towards the husband, or a male partner. It'd be great to do some of this, extrapolate this a little bit, but in
Right,
your research, then that would impact the husband being warm with the wife magnified 20% from how I am with the husband.
right, right.
Wow. Like, that's
Yeah,
huge, right? Because most wives are coming in like, where are you? Do you care about me? You don't even care. You're off in your old world, your own world, and I don't really matter at all. And now the wife is getting, I'm thinking when I'm warm in therapy, I'm pretty warm. But of course, I've been practicing it for a long time. But
yeah,
for
you're an
that to
expert.
increase, that's huge.
Right, and I think it's also important to point out that our therapists in our sample were really not particularly warm, but when they were warm, it made a difference. So even among these therapists who weren't very warm, we still had that significant effect.
So that's
And
really important that you can take anxiety, students with a lot of anxiety that don't really know what they're doing, they don't have a particular, they're trying to do something, but they're not very expert at it at all, and that you still see that sort of impact just with them increasing a little bit even their warmth.
right, right. So we created a prototypical plot where we put in into the equation with the slope and intercept that we used a standard above the mean and a standard below, a standard deviation below, okay, above and below the mean. And so what we found is that with lower warmth, the trajectory is actually that over time, husbands become less warm to their wives if the therapist's warmth is low. But as the therapist's warmth increases, that trajectory, the whole trajectory shifts so that the husband's warmth actually increases over time longitudinally in therapy, which I thought was really cool.
That's really big in the sense
Yeah,
of how I am as a therapist using me as a tool has a direct impact over that responsiveness of the husband to wife across time.
across time. Across time, and we also assume that there are probably some triadic effects going on. We didn't tease all of those out and measure those, but it makes sense that there would be some recursive and triadic effects when the other partner is there and watching the way the therapist is interacting with their spouse. But
So when you say triadic effects, you mean that the wife would also be involved in some way in responding to the husband, and probably some way that the therapist impacts the wife with warmth
right,
too. But
right,
we don't know what those are. What we really know is so it's not like we don't want to be warm to the wife, right?
right, 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 exactly.
Or that the wife might not be at all responsive to us, or to because alliance is also a construct that's very important. So, but
Absolutely.
but to
Both
see that
partners.
so directly from the husbands who typically, if we look at men in therapy, you mentioned this a little bit, that men are often the ones that are kind of dragged to therapy, don't really want to be there, aren't sure already feel like they're going to be ganged up on, maybe be the bad guy in some way, and that here they are increasing their responsiveness so much, not based on model, but just based on this factor that you're really were able to tease out of warmth. That's really powerful.
Right, and it matters because we know that male alliance is a big deal for outcome in therapy. So if you don't have buy-in from the husband, you're going to have a lot harder time in therapy if you look at the literature on males. And males come in, like you said, often already feeling like failures, feeling hesitant. They're very aware of gender stereotypes. And so they come in doing a little bit of self-monitoring and worrying and having high anxiety. So the therapist warmth can, I think, really make a difference there.
Did you, in the research, were the therapists both male and female therapists?
Yeah, we had half and half.
Mm-hmm. And so the gender of the therapist wasn't part of you were able to kind of rule that out as one of the factors.
It didn't seem to make a lot of difference,
Mm-hmm.
so.
Oh, that's really exciting. So you had a couple examples or a couple of stories of some things that changed. I think you were talking about the trajectory across time.
Right. Well, like I said, I'm not sure exactly what you're asking, but
Oh, I didn't. You had just mentioned that you had an example or a story.
Well, I had examples of just attuning in these moments that you brought up when we as therapists get very anxious. And one was that I think I pointed out for the newsletter that's not published yet. But is it okay if I bring up that example?
Oh yeah, sure. Also, you and I've also, we should just say, let you folks know that Lori and I also are doing a little bit of writing and trying to help in other ways. Also, we're going to be trying to do we have a training planned in January, a 3-hour training on how to learn to what key phrases, what you can say, what kind of body language, all those kinds of things, what gets in our way. We're going to do a little training on that. But we have done and submitted a newsletter article on the summary of the research. So this is one of the stories from one of the examples from that.
Right, and so I think I pointed out that I had a couple where the husband actually became very difficult for me because he would get so angry. He would get so impassioned in session, and his wife historically would become fearful of him in those moments. And I didn't experience fear, but I found myself withdrawing from him because he would push me out with his anger the same way he would push her out. And I didn't particularly, if I can reveal this, like him a whole lot. It wasn't particularly easy to want to be in the room with him. I wanted to withdraw and not have to deal with him because he would be so unpleasant. And
I guess we all know clients like that, right?
Yeah, right. And so I knew that this pattern was happening, and I decided that I was going to just go full force EFT and really try to tap into his positive intent and really be with him. And I had a therapist supervisor at BYU back in 1989 who was always emphasizing being with your clients. And at the time, I had no idea what she meant. And one time I got pulled out of a therapy session, and she said to me, "You're trying to fix it, you're trying to fix it." And I said, "Yes, I am trying to fix it."
That's what therapy's about, isn't it?
That's what I'm trying to do. And she said, "I want you to just go be with your client." And I think this is the very thing she was talking about, but at the time, I, of course, didn't know what that meant yet. And so anyway, with this client, I noticed right in session that he became very loud and agitated, and his wife started to withdraw, turned away, and I found myself really just sort of backing up, just infinitesimally small distances, but just wanting to back away. And instead,
aggression has that kind of impact on us, right? That's an automatic response to aggression. That it's scary. We want to, we either want to fight or get out of there.
Right, want to go away. So instead, I moved in and I made eye contact, and I used a very soft voice, and I said, I can tell this is really important to you, and I'm not sure I understand what's going on, but I really want to understand what's going on. And I meant it when I said that. I wasn't lying, I wasn't pretending, I really meant it. And I really had no idea exactly what was going on. So my disclosure of that actually brought my anxiety down. But when I attuned to him, and in a way, I think, looking at it now, applied warmth, it immediately shifted in the session. And he was able to sort of attune with me. And then we could talk about the pain. You know, I said, I can see there's pain. I can see there's pain. And she gets to see the anger all the time, but I'm worried it's pushing her away. Can we look at the pain part of it? And it was just in that increase of warmth that I got him to sort of come back into the session, you know, symbolically speaking.
Right.
And
His anxiety, his aggression calmed down.
Right. Bring it right. Help him to manage that emotion. And it just made a huge difference in session. And then I think I brought up another time I had a client once who was demonstrating extremely paranoid characteristics. And it became very confusing in the way that paranoid clients will often become, because she was making statements that made no sense and was not linking her thoughts together. And in the moment, really, all I could do is just be warm and be with her. And I remember that I thought, okay, I am just really going to try to be with her. You know, then I'm going to get a release to talk to her medical provider to see if this paranoia is from the medication, which it was, which I verified that later. But in the moment, I attuned to her, and she had this very rapid speech pattern, and she slowed herself down, and she said, "You're listening to me." And I said, "Yes." And she said, "No one ever listens to me." And she started to weep, little tears started to drip down her face. And I thought, how sad. But in the moment when I was attuned to her and she said, "You're listening to me," her speech pattern changed. Now, I know she had paranoid characteristics from the medication. So I'm not saying that would fix that, but I just am pointing that out because I think it makes such a huge difference to our clients and in their ability to be more adaptable and flexible in their patterns, because they get so rigid and constricted. And if we get cold and our anxiety ridden ourselves and withdraw, we actually feed into that rigid, constrictive pattern, because warmth is a safety cue. And so ultimately, if we want to generate safety in session, then we really need to emphasize warmth. And warmth is also assessed incredibly quickly by people. In studies of warmth and competence, people always assess warmth very quickly. And it actually can make you appear to be more competent, but it's judged immediately. And so I think it's really important to understand it with the implications of safety.
Oh, that's really interesting, to tie it to safety. I know we've talked quite a bit about that, you and I, but when you were telling that story about being with both of those clients, especially the where she started to tear up, it reminded me so much of a few weeks ago. I was in San Francisco at an emotionally focused family therapy training, and they showed this video. I wish I knew the name of it, of the therapist, I'm not sure, she maybe was a coach, I'm not sure, a nurse attendant somehow, to an older woman with Alzheimer's who really had very little present memory functioning, interaction ability, was speechless most of the time. And she, this worker, I wish I knew her name because I know she's quite famous, came up and would touch you. Know who I'm talking about?
I do. I have a copy of that.
Stay with her and really reach towards her, be so warm with her, right? Yes. And she would come out and have some lucid moments.
Yes.
From that direct contact that really just exuded warmth.
Right. It's a beautiful, beautiful clip. I love that. But it's the same thing, exactly. And I think it's because it provides safety.
So when you say that, I think about Jim Cohen and some of our neurobio research and the threat that happens when couples are in distress. If you work from an attachment perspective, which some of our listeners may not, but if you do, the what happens in distress with the fight or flight response that happens, that if the therapist interjects with warmth, that safety component can come in, and the danger signals, the danger alarms can start to be a little bit quieter, which frees up people for
Making choices. Yeah.
different choices, different responses, different awarenesses,
Yes.
that become really essential in couple therapy.
Right. Right. Absolutely.
So that warmth as a way of connecting it to safety is so important as a construct to think about, to really think about that. And what happens when we're tense, that's maybe our own feeling of discomfort or insecurity or being unsafe. Even though we're there working really hard to understand our clients. And that's one part. But I think the other part is sometimes we just don't know to do it. And then there was something else that you said about competence.
Oh, yes.
Right?
Yes.
And I think many of us are kind of taught in this way of being as the professional, or like there's a way of being that distance is the way to be, or
Right.
something like
Right.
that.
The distance is professional.
Yeah, the
Right.
distance is professional.
Mhm. And I noticed that with my BYU students and other students that I supervise, is that they struggle a little bit with that because they're trying to be professional, they're trying to learn how to be therapists, and so they automatically create this distance, and they're actually trying to be the opposite of warm in a way.
Yeah.
It appears. I mean, they're trying to build an alliance through the content of their language, but they're
From having
really,
this kind of professional demeanor or something that
yes.
as you say, doesn't necessarily convey warmth. Let's come back to that. I just want to say, Sandy, thank you. Naomi Field, was the woman in the video that I was
Oh,
totally blanking on her name.
yeah, I
So
went
thank you
to
so
it.
much for that, Sandy. So let's go back to this sense of professional competence. There was some way that tied to your research, the professional competence, was there?
No, it was just a way of thinking
Just
about
a way
it.
of thinking about it.
Yeah, yeah, it was just a way of thinking about it with my observations and supervising students. And just, that across the board, we need to have professional distance, right? I mean, we need to be professional.
I mean,
But a lot of
maybe
times,
one of the ways we're trained, or maybe one of our own kind of ideas about how we be successful with clients, how we present ourselves, and like looking competent, we might think has to do with having this austere or really, distant professional demeanor.
right, and I think in the traditions of psychotherapy, that was actually encouraged, right? I mean, traditionally, it was, I'm the expert, you're the sick person, and we've come away from that a little bit more, or a lot more in other mental health professions. But I think that this study sort of speaks to that as
Also, kind of
well.
the blank slate, or the make sure it comes from the therapist or from the clients. Don't
Right,
give too much input, that way.
right, right.
Yeah, it's around us all over the place, isn't it? Not
It
to kind
is.
of use ourselves, really, because warmth, as you're describing it, um, when you're including nonverbals and support and these validations or content areas that you're doing, that's really a lot. We don't want it. It's not like we want to make the therapy about us, but that's really us offering part of who we are and what we feel and a way of being with our clients, and that's really different. And we might think that where we came from, that's not not going to translate to professional competence.
Mm-hmm. Right. But in my observations, it has so much to do with alliance, because warm therapists generally have better alliances. Mm-hmm. And if they're also competent, then over time that really works for them. Now, if their competence is lacking, then over time they may have clients who get frustrated and disconnect and disengage. But I think you can see that around you. You know, popular therapists do tend to be warm often.
And effective, like it really can increase the effectiveness of the therapy. So, I mean, in addition, you want to have a good model, a good way of working. But while you're getting there, or if you have one, you can always just infuse a little more warmth in there and really help those husbands out, or the male clients out, in being able to maybe access more feeling and more responsiveness to their partner, to their wife.
Right, right. And husbands may be picking it up several ways. It may be in part from modeling behavior. It may be from direct encouragement from the therapist. But I just think it's exciting that it's making a difference, because it is often the men that we lose in therapy.
Mm-hmm.
And you know, they don't, and traditionally I think we did have some models that actually villainized men or demonized men. I remember being in a class back in graduate school when I was getting my master's degree, and having one of the a member of my male, or the cohort, raise his hand and say, "Why are we always trying to get men to talk more? Why don't we tell women to not talk as much?" You know.
Mm-hmm.
But what he was reflecting was a perceived bias in couples therapy, which I don't think is entirely imagined. When I was walking with Sue Johnson, I was telling her how much my clients like to hold me tight, and it was always the male clients, which surprised me, because I couldn't pay my husband to read a marriage therapy book or a self-help book, right?
Right.
But it's actually my male clients who get so excited about it and wanting to change the patterns in their marriage. And she pointed out that it really is a model that is not blaming to men, because the focus is on the cycle that the couple's creating together. So that was her guess for why that was more appealing, but that's been my experience. So I think it's exciting when we've got stuff that shows that men will stay more engaged.
Yeah, that they'll be more engaged, they'll enjoy therapy more, they'll start to enjoy their partner more, which is probably why they're in therapy to begin with. So.
Right.
So we get a lot of traction out of warmth, just like this one simple sort of thing that actually isn't so simple, really, because we can break it down. It's been broken down. Your research has looked at many components of that, and then through, you know, we're extrapolating a little bit, but through supervision and our experience about how that interacts with safety, what that does with alliance, those are really important things that especially when we're really with distressed couples. Like I just remember, you know, so vividly, because of just being, you know, I could even think of a couple yesterday that I was with. When the high distress comes into the room, how when I'm tapping into feeling warm, I feel more confident, I feel more at ease, and then the clients become immediately, well, maybe not immediately, that's probably a little strong, but within minutes, you know, that changes, that when I can access kind of those warm feelings and express them. So I was doing some supervision the other day and used this example of a client where the female partner was saying something about mistrusting her husband, and that he would do, like that he would intentionally leave her, something like that, you know, that she felt really bad about. And while she was sharing, I asked her something related to this leaving, and or asked her to share something about her feeling of alone and what it's like, and she said something like, "Well, I guess I leave him. I said, so you always want to stay, you always want to be present." She said, "Well, I do. I guess actually I leave him sometimes, but my intention is that I always want to be present." And she was really struggling, and I was, struggling to kind of understand her. And then there was this little moment when she said, "I do this thing too that, that he does that she'd been really upset about him for, too. She'd been upset to him about it, and I just found this opportunity, like, to smile at her and to be warm with her, like, oh, you do that same thing, but look at that's so great because you're like saying it out loud, that's when you do it you don't mean to do it, like, thank you for sharing that and being aware of that."
Mm-hmm.
And that moment of me kind of feeling good about her catching herself or admitting something that I think is pretty hard for many women to admit, um, felt like a real alliance building and a bit of a turning point in her level of contempt and blame that was happening in the room.
Right, right, absolutely.
So it's not the easiest thing to learn, and I'm aware that we're kind of getting close to the end of time. Are there things else about the research that you want to say? And then we can talk a little bit about what we're going to do in January and when we're going to do that, so people, if anyone is excited as we are about how do we do it, what are the phrases that are really effective, those kinds of things that we can talk about that too. But is there anything related to kind of the research pieces of this, Lori, that you really want to leave with our viewers today?
I think we've covered the important part, and I liked your example at the end because as you were talking, I thought that's exactly the type of thing that would be coded as warmth. Your expressions of encouragement and praise and smiling, and so I think that's actually a great place to end on that.
Okay, great. So we've been together a couple of times. We've been doing a little bit of writing. We've met together several times in person and online to talk about what we know about warmth and how we can help, especially since both of us are involved in training, supervising therapists. I'm involved in training a lot of therapists to be better couple therapists. This is such a far-reaching bit of research that anyone from any model can begin to utilize with
Right.
their couples, with their distress. And so we got together and we thought we could probably do a pretty good job of helping people work on these three aspects of warmth and get some mapping done and modeling done and mapping about how to utilize it, what blocks are for it, in a little 3-hour training. So do you want to, maybe you can share a little bit about what you anticipate we're going to do?
So as we talked, we decided to focus on the nonverbal, the supportiveness, and the content areas, since that's what we measured. And we were coming up with, I think actually it's probably good that we both have supervised students because it's given us also a lot of ideas for how would you put this into practice. And I know that I've already been using it a lot, whenever I'm supervising therapists, and I talk a lot about warmth, and I'll talk to certain therapists about how can we do that. And we also wanted to talk about how you manage your own anxiety and become warm when you don't feel very warm, or when you're terrified, or those things that happen to us when we're
or maybe don't even see yourself as very warm as a person, right?
Right, that too, because certain people are just warmer, or maybe that's a construct, a subconstruct of extroversion or introversion, but we just know some people have an easier time with that. But I think that everybody can apply warmth even if you don't see yourself as naturally warm. So that's why I was excited about doing this little training with you, because I really do think it's something that people can get better at, and it's a pretty fundamental skill at the same time.
Yeah, it's a basic skill where no matter where you are kind of in your practice, your practice ability. If you're learning a new model, or you're learning couple therapy, or you're an experienced therapist, that infusing a little bit more warmth, knowing what those pivotal points are, and the way you can use the three constructs of warmth to practice and increase in your practice. Just think of that 20% gain that those male clients, or I think of the withdrawer client, you didn't look at it, you looked at it as husband and wife, but I think in terms of the pursue withdraw dynamic, that you can really help those withdrawers with, and of course the pursuing partners as well. But that anywhere along the way that could be so helpful. So we have that 3 hours of $59 for the training. For those of you that are on live with us, it's a $20 discount today if you want to register. And there's a link in the chat box, I think, right now. Hopefully that's working. If it doesn't, email me. I'll let you have that link, so you can get it today. For being on live with us and being part of Talk Time with us, we're so excited to have you here. We want to thank you for being here. So $39 today for a 3-hour training. Both of us will be with you. We'll meet online. Recordings available, replays available. We'll have some cool handouts for you. And in between now and then, we can also ask you what your blocks are, or what you can be noticing between now and then when you don't feel as warm. What types of couples or what types of moments, and then we can also be responsive in developing the rest of the pieces of the training to particular needs of people that sign up.
Yeah, I'm excited. I think it sounds great.
So thank you so much, Lori, for your incredible research. And I mentioned it at the beginning, but I want to just say it again. Getting the AMFT Dissertation Award, of the Year Research Award, is a really big deal. And so congratulations on that. And then the impact that many of us, I did a dissertation that will never have any impact on the field whatsoever. I'm just glad I got it done. But this is research that can really make a big difference, and so I'm very excited to kind of be with you and helping to try to spread the word about this, because it's so, it's kind of its own construct. Well, I'm sure it interrelates to other things, that you were looking at that so specifically and found such a powerful effect from it. So thank you so much.
Thank you. You're very kind, and I so appreciate your support. So,
and that was a beautiful example of warmth right there, Lori.
You're sweet.
If we could reach through and touch, then would be with a little half hug or something would be all over the warmth, wouldn't we? So thank you, everybody, for being with us, and feel free to let other people know. We just think that this makes a big impact in helping distressed couples, and we're glad for you and what you're doing in your practices to help distressed couples, and thank you for your time in being here. See you next month. Oh, we should say also, I want to say next month, Dr. Stephen Porges is going to be on talking about his polyvagal theory with me on Talk Time. So watch for that announcement as well, for the free portion of Talk Time. So I'm really excited.
That's a good one.
On what's going to be coming up, and that we can really tie that into warmth too. So that we're going to bring in a little bit of his research when we talk about warmth next month too.
That's
online.
Exciting.
Okay, thank you, everybody. Thank you, Lori. We'll look forward to seeing you all offline, other places online, on Twitter, Facebook, and emails, and other places that you may be. Happy holidays to everyone, and thank you for all you're doing.